Good day everyone, this is Dr. Chee-Wee again, and in this second video on range of movement measurements, we're going to have a look at measurement properties of goniometry. Before we start, let's remind ourselves the aims of this week's session. By the end of this week, you should be able to apply the principles relating to the measurement of physiological range of movement. Although the aim says that this is specific to the lower limb, these principles apply to all regions of the body as well. You'll also understand the importance of consistency in the measurement of joint range and be able to critically evaluate the factors that may contribute to the measurement properties of range of motion outcome measures. Let's make a start with the reliability and responsiveness of goniometry. For reliability, universal goniometers usually have good to excellent reliability. This is despite it being a simple to use and non-expensive way of measuring joint range. As with any tools, there are several sources of error that may contribute to its unreliability. For example, if the joint axis moves during the testing, now this contributes to the unreliability. Other errors include variations in manual effort exerted by the tester during passive range of motion, and also the patient's varying effort during active range of motion. Unsurprisingly, the intra-tester reliability for goniometry is usually better than the inter-tester reliability. For all forms of reliability, it is better when the testing positions and measurement methods have been well defined. An interesting factor that may improve reliability is using an appropriate sized goniometer to measure the specific joint. If a smaller joint is measured, usually a smaller goniometer should be used. In terms of the universal goniometer's responsiveness, it is about between 5 to 10 degrees. In addition to the previously mentioned factors that influences reliability of goniometry, shown here are further factors that may contribute to decreasing the reliability of goniometry. If the testing movement involves passively moving heavy body regions by the tester, this may quite understandably decrease reliability. For some joint movements within the body, it is controlled by muscles that traverses multiple joints, for example, the quadriceps and hamstrings. In these cases, there is an increased probability that reliability may be affected. As is well known, it is much harder to measure and estimate joint movements in the spinal regions compared to the peripheral limbs. This also means that reliability may be affected in such circumstances. Depending on the person's body type and the location of the joint being measured, it may be much harder to palpate and locate the body landmarks for measurement. If so, then the reliability of the measurements may also be decreased. As goniometry and measurement of range of movement mostly uses instruments, the type of validity often investigated in studies are criterion related. And there are several reference standards to which goniometry can be compared with. For example, imaging, photography, video recordings, and motion capture systems are just some of these examples. Generally, goniometers have moderate to good concurrent validity when compared to imaging techniques. As with reliability, joints in the peripheral limb generally do better than the spinal joints. Now, this is only a very brief summary of the measurement properties of goniometry, and there is a large aggregation of research in this area. For anyone interested, I would recommend that you read some of the joint-specific reviews on this particular area. Before I end this video, I would like to leave you with two questions. My first question is there one particular way that is best for measuring joint range of motion? And why do you think that? The second question is, what is the role of measuring physiological range of motion in relation to functional movements? Is it important? And why do you think that? Now have a think about these two questions and then share with your classmate on the thoughts that you have for them. In this short video, I have very briefly talked about some of the factors that may affect reliability for joint range measurements. I've also mentioned in passing the general view about the validity of joint range measurements. Now, I hope you have learned something from this short video. Now, this is Chee-Wee, and I'll see you in my next video. Bye.